Hi, my name is Tasha and I'm going to be performing the NG tube insertion video. To begin, you want to make sure that you have the orders from your healthcare provider. You do want to make sure that you have all of your supplies, which is going to be our nasogastric tube here. We have our tape, which I've already taken off and gotten ready. I do have my gloves. I have my water soluble lubricant. I do have some tissues here, and I have my cup of water and the 60 ml syringe, which does have the adapter. I do have my MSS basin, which with an additional one if needed to pretend like it's a sterile cup as well. I do have the absorbent pads. I have my towel as well. Also, I'm going to verbalize that we would have our pH test strips or our meters. Also could have the suction apparatus with tubes and canister. It would be connected as well if it's prescribed. Also, we would have a safety pin and elastic band. Okay. So to begin, we're going to want to perform hand hygiene. We're going to want to place on our gloves. I will be introducing myself to the patient and asking the patient the two identifiers, which is going to be their first and last name and date of birth. Once I've established I have the correct patient in front of me, I'm going to explain the procedure to the patient. I will let the patient know that the doctor has ordered a placement of an NG tube and that the tube is going to go from the nose into the stomach. The tube is going to be hooked up continuously to low continuous suction. This is going to clear out the stomach, which ensures that there's going to be no stomach contacts, which will then allow the bowels time to heal. I'm also going to ask the patient if I do have the consent to move forward. Patient states that's fine. I'm going to be raising the bed, which is going to put the patient into a high Fowler position, of course, if it's tolerated. I will provide patient privacy, make sure that they're comfortable, and that myself and the patient is safe. I'm now going to be prepping the tubing. By doing that, we're going to place the tubing into warm water. This makes it more comfortable and pliable. Before we insert the tube into the patient, we do want to assess the nares. So we're going to get our light. We're going to ask our patient to hyperextend their head, which is going to be pushing their head back. We do want to look and make sure the patient has everything is intact. Check, the tissues. Check for any irritations, any abrasions that the patient might have. We want to look for any obstruction, any deformities. Check the membranes for any redness or any swelling. At this time, I'm going to ask our patient to cover one nostril. They're going to take a deep breath in and then out, including the other. Once they've done both sides, I'm going to pick the nostril that has the best airflow. For this purpose, I'm going to choose the left nostril as it is a bit closer to me. I'm also now going to determine how far to insert the tube into the patient. By doing so, we are going to take the tip of the tube, which is going to start off by the tip of the patient's nose, and it's going to go to the earlobe, and then from the earlobe, we're going to want to bring that down to the xiphoid process. And this is going to be at the 50 centimeter mark. We don't need to mark this with any tape because fortunately this tubing already has all the markings on it. Okay, so now that we've established it's going to be at 50 centimeters, I'm going to be taking our pad and placing it across the patient's chest just so we can avoid getting them in, anything all over them. All right, I am now going to get my tube. I'm going to lubricate it well. With my lube. If needed, you can use water as well. I'm now going to insert the tube. It's going to have, with the natural curve into the left nostril. I'm going to ask my patient to look up so I can gently advance the tube into the nasopharynx. Okay. All right. So now that the tube has reached the oropharynx, as long as it hasn't met any resistance, I'm going to make sure that the patient has felt it in their throat, they might gag or they might have retched or anything like that. If there were to have any resistance, then I would just insert it into the other nostril. At this time, I'm going to ask the patient to tilt their head forward, and I'm going to encourage my patient to drink and swallow. I have my water cup here. If my patient gags or it stops passing through, I can have the patient rest. I can have them take a couple breaths or maybe take some water to calm, down their gag reflex. Now I'm going to be passing the tube 2 to 4 inches. And as we go, I'm going to have the patient swallow until we reach the 50. So we're going to go 2 to 4 each time. And then they're going to swallow. And so forth. Okay. I have reached the 50 centimeters. So at this time, I'm going to get my syringe. I'm going to withdraw about 5 to 10 mLs of the patient's gastric content. Once I've done that, I'm going to place it into the specimen cup. I'm going to take out our pH test strips. We're going to want to check that, which needs to be at between a 1 and 5, which is going to let us know that the tubing is placed correctly in the patient's stomach. Of course, everything's going to show correct for the placement of the tube. If there was any indications that it was not correct, I'm going to remove the tube and I'm going to start all over again. At this time, I'm going to secure the tube by taping it to the bridge of the patient's nose. And I'm going to secure the tubing to our patient's gown with our safety pin. I am now going to return the bed to the lowest position. I'm going to review the x-ray to make sure that the placement is correct. Once I'm noted that it's in the correct position, I'm going to attach the tube to the suction source, or if it's on a feeding device as prescribed, and then clamped at the end of the tubing. I will now let the patient know how to care for after placement. If we had suction applied, we'd want to maintain the patency of the suction tubing by, of course, keeping the accurate records of the amount of drainage that is coming out from it at that time as well. I would now perform hand hygiene. I will make sure that my patient is safe and comfortable. I'm going to document the procedure for all the care that we provided, all of the data, and of course the patient's response into their patient record.